I'd like to welcome you back to the show. And our next guest is Paul Seegert. He is a managing partner of PCS Advisers. And we're going to be talking to him about a couple of things having to do with healthcare issues and the vaccine controversies. Paul, welcome to the show.
Thank you for having me.
Paul, could you tell us a little bit about your background? You're considered an innovator and an architect on healthcare solutions. Tell us how you got involved with this.
Well, my background initially, I was a Russian intelligence analyst. I worked for the NSA, so I liked numbers. I have nerd credentials, but I wanted to have a family, so I ended up going to work to get a more normal schedule at an insurance company. And I saw pretty quickly we had a really great business model for the insurance company. We could give employers and individuals an increase in premium each year, not tell them exactly why, and there wasn't a whole lot they could do about it. That made me want to get involved as a consultant to see if we couldn't do a better job with our payment model around healthcare, and we definitely can. And then, fast forward 15 years later, I've had the chance to work with a couple thousand employers in just about every state, and have shown many of them how to cut their costs in this area in half while accessing better quality care for their employees.
And so do you do this as a business or did you write a book, or how do people find this out? Because as you mentioned, this is one of the highest costs of employers outside of wages.
That's right. It's in the top 4 or 5 on just about every employer's cost stack. And I've been in the media quite a bit. I just delivered the keynote at the Global Conference in Finance on healthcare, health insurance in the U.S., what we can do to fix it. So I haven't stopped long enough to write a book, but I've had a chance to start to speak in a lot of different spots with folks like yourself around the country on radio and TV to get this message out that we can do better. You look at the post-ACA world that we're living in terms of healthcare. This is our report card. Premiums are up 87%, or deductibles rather are up 87%. Premiums are up more than that. And insured Americans hold $141 billion in medical debt. That's new as of about a week ago. Still, the number one cause of bankruptcy is medical bills. So we can do a lot better.
Could you give us some ideas of what employers can do?
Well, absolutely. What they need to do is challenge the system as it stands today in terms of the retail insurance model. I'll give you a quick example of what I mean. I was looking at an employer in Dallas, Texas recently, but this could be true anywhere. And they were with Blue Cross Blue Shield of Texas, but it could be true with any retail insurer. And you could go and get an MRI at 10 different locations within 25 miles of this employer. All were considered in-network. So as far as you knew as the consumer, you were doing the right thing. You were going in-network, and you would pay a $100 copay according to this particular plan design. What they didn't know was that behind the curtain of the insurance payment model, what we found was that the low-cost facility would take the $100 copay, turn around and bill the plan $700. The high-cost facility would take the same $100 copay, bill the plan $7,000. All in network, all agreed to contractually by Blue Cross Blue Shield of Texas. Why would they do that? I think is a really good question. And it's because we created rules in this last 11-year run since the ACA kicked in where insurers actually do better when claims costs go up in their retail portion of their business. So we have to address that, and we have to fix that. And there are things you can do. Step one is work with a consultant, and there's a growing number of them around the country that will bring you alternatives to simply buying the retail offering from the 4 or 5 retail insurers that are left.
So if somebody had gone with the 700 versus 7,000, wouldn't it be the insurer that saved the money versus the employer or employee?
Well, what we've got is a situation where we've trained the consumer, the employee and their family, in this example, to consume in terms of copays and deductibles. And the insurer, according to the MLR, the medical loss ratio rules of the Affordable Care Act, we told the insurers you have to spend 85 cents of every dollar that the employer sends you in premium or the individual sends you in premium on a claim. You get to keep 15 cents. So what they what we did is align their interests with large hospital systems and large provider groups, where both did well when costs went up. And so now they simply go out and make these contracts, allow prices to rise, knowing that they'll just, in a debit accounting fashion, turn around and hit the employer with a larger increase. So they pass it through to the employer.
All righty.
Plus 15%.
Well, I want to talk with you a little bit about what's going on now with regard to COVID. There are some employers, there's kind of different thoughts out there. Some employers think that, hey, if I could get sued if somebody says they catch COVID at work. There's other employers think I could get sued if I pry into my employee's medical history, i.e. asking them if you got vaccinated and or forcing them to get vaccinated, and then they get vaccine injury and I'll get sued that way.
Right.
And then there's some of them that are just totalitarian, saying, hey, we want you to get vaccinated whether you've already had it or not. Blah, blah, blah. So there's all sorts of chaos, confusion, and turmoil.
I agree. And it's pretty well established that employers can mandate the vaccine. Although, interestingly, most that we've seen have not technically mandated it. There are some now that have. But for the most part, they've said you have to get the vaccine or submit to very inconvenient things in order to try and, I think, coerce the small balance of people that are left, maybe, to get vaccinated. There's an interesting lawsuit going on right now with George Mason University law professor and the university. And what they've required is you get vaccinated or you submit to weekly testing, you wear a mask and socially distance and do all these things. In his case, he caught COVID, he recovered, he has antibodies. He actually has better protection than from some of the vaccines and broader protection than all the vaccines. Look at the most recent studies, continue to confirm that.
We just lost you, Paul.
Oh.
Hello?
Are you able to hear me now?
Yes.
Oh, sorry about that. My cheek might have hit the mute. So, in any case, he's suing on the basis that he has natural immunity. Why should he have to get a vaccine? And that's a really big, glaring hole in this big COVID conversation that we're having. That's a little bit unique to this country. We seem to, at least in the mainstream media, ignore the science, part of the science. Everyone says they're following the science, but there's part of it that includes natural immunity that we're not talking about very openly.
Well, my bottom line is my understanding of the law, and I've had a lot of lawyers and doctors on this show, is they can't mandate that vaccine as long as it's still considered under emergency use. It's emergency authorization. If, in fact, the FDA or whoever finally approves it final, then, yeah, they can. But right now, it's an experimental technology under an emergency authorization. And like you said, if they give them the choice of, vax or mask and test, they can do that. But my understanding is that they're on shaky ground to try to mandate this for their employees. Paul, we're going to take a break. We're going to be right back with more.
If your family and your community are important to you, then you are in the right place. You're listening to The Andy Caldwell Show.
I'd like to welcome you back to the show. My guest, Paul Seegert, he's a managing advisor at PCS Advisers. And what he can do is he can help employers cut their costs significantly for health insurance while improving the quality of care for employees. Paul, how do people get a hold of you if they want to use your services?
Well, they can find us at PCSadvisers.com. We spell it with an ERS, which can be a little tricky. And there's lots of ways there that they can get in touch with us.
All right. What we're talking about with Paul as kind of a segue, we're talking about vaccination status and these laws, and there's a lawsuit. Hopefully they messed with the wrong guy, a professor. He's been a professor for 24 years, a law professor at George Mason University. And this is a perfect example of how science is not driving this debate. Folks, in the old days, the best way to protect yourself against measles as an adult was to get measles as a kid. Even though measles was dangerous to some people, the mentality used to be get it over with because your natural immunity is the best defense. Well, there's studies all over the world right now that the best defense against the variants, the COVID variants, is natural immunity, that natural immunity applies to all the variants, whereas the shot only worked with the novel COVID-19 virus. And so what they're trying to do is tell this law professor who's got antibodies that are better than the vaccine, they're telling him you got to get the vaccine. Well, the vaccine is dangerous to people that have the antibodies because their body just doesn't know what to do with all of the above. So he's suing his law school. And this is one of those things that, Paul, they never dealt with the people that were asymptomatic. They don't deal with the people that had antibodies. They don't deal with the fact that some people with healthy immune systems would be better to get it because, again, it's broader immunity or broader shielding. It's driving me crazy.
Oh, yeah. Any time in this debate that we hear someone say, I'm following the science, they usually follow that statement with some science and some politics or political science in any case. We have so much evidence all the way back to the beginning in some of the most hard-hit areas like Italy that shows those who caught COVID and recovered have durable immunity. And then we also have many studies that show the immunity that you get from these vaccines does decline over time. And I'm not an anti-vaxxer. I think the vaccines were, a modern miracle, and that's fine, and especially for the very vulnerable parts of our population. But there's many experts in public health. Folks should go look up the Great Barrington Accord.
Yes.
Some of the best minds at Stanford, Harvard, Oxford, and some 18,000 bright minds from all around the world basically said what you just said, that what we should have done was protect the vulnerable and then allow the rest of the population to get and recover from COVID. That might, if you watch a lot of mainstream media, that might sound really crazy, like we would have just killed half the world or something, but that's not how it would have worked out. We would have gotten to herd immunity just fine. One way or another, you get there. A country that's approaching it, I think, in a much more level-headed way than we are, the UK, just 2 weeks ago, they went out and they've been doing this. They did random blood testing of their population to see where are we in our track toward herd immunity. Not just broadcasting vaccination numbers. Certainly they're promoting the vaccine, but they also acknowledge there's natural immunity that can be obtained. They went out, tested the population, and found that 92% of their population had protection, either through getting the vaccine or from getting COVID and recovering. So then,
Paul, you're fading off again there.
Sorry, is that better?
Yeah. So let me bring something up here. One of our text line callers at 361-1366 mentioned, they can't mandate the vax, but they can make your life miserable. So yesterday, Los Angeles City Council, now this is not final. They voted on it, but they've got to work out the details. They say, okay, you unvaxxed people, you can't go to restaurants or gyms or indoor concerts or what have you, even though working out is the best thing for your immune system.
It seems like it would be very sensible to, at all these vaccination sites, also have antibody tests. I caught COVID, my wife caught COVID, our 5 children caught COVID. Everyone in our office caught COVID, but we didn't have anyone that was high risk. So nobody really worried. Everyone was fine. And there were antibody tests done in our office, and guess what? We have antibodies. So we didn't get vaccinated, and I'm not an anti-vaxxer. It just wasn't necessary. And so it would seem pretty unreasonable to me that my activities should be limited if I have protection.
So, Paul, let me tell you, I've got an op-ed. I write op-eds for the Santa Barbara News Press, and I've done probably 300 shows or show segments on the subjects we're discussing today. And some of it's pretty provocative, including one of the world's top virologists. He won the Nobel Prize for virology work. He believes that what happened is the virus did not create the Delta mutation, but the vaccine did. In essence, why? Just like, let's say there's a flu, some kind of a bug going around, and every doctor in town prescribed antibiotics to those who were sick and to those who were not sick. That bug would mutate, and the antibiotic would no longer work.
Yeah, for its own survival.
Yes, and they believe, that's what he believes is going on, is the vaccine created Delta, not the virus.
And then the next one after that, Gamma, that we're talking about now, or beginning to, just saw a study within it actually was even cited in a recent article about this lawsuit, that they had an outbreak amongst a group of miners of this Gamma variant. And what they found was all of those that were infected by the Gamma variant were vaccinated, and those that were not had natural immunity. And so it sounds like heresy for us to have these conversations, but if we're going to have a scientific conversation around COVID, we have to acknowledge these things in order to be, to be scientific. And
see, to me, I'm not anti-vax either if it's a real vaccine and it's proven. My problem with this is it's most of them, the Pfizer and Moderna, it's not a vaccine, it's a technology. It doesn't have dead or live viruses in it. It's, right. As the inventor of mRNA, one of the inventors, people we've been working on this for 20 to 30 years, says it's gene editing technology. And the other thing that another scientist has said is the COVID vaccine / mRNA technology worked against the spike in the COVID-19, but the Delta's got a different spike and it's not working against that. Therefore, they think that the regular vaccination is going to become obsolete. And the third argument, the reason they're still trying to shove vaccines on everybody is to cover their tracks. We're now the control group that didn't get the vaccine. And in time, if these theories are true, in time, the people that are going to be sick and dying are the ones that got vaccinated, not the ones that caught it and had antibodies, or the ones that for some reason were just not vulnerable.
Yeah, I think there is so much evidence. You can't deny natural immunity. The CDC's own data, they suggest that as many as 8 times more Americans have had COVID as opposed to the official count, the confirmed count. When you put those two numbers together, that's why we have such low hospitalization. It's a little higher now, but nothing near where it was at its peak. Hospitalizations and deaths are maybe at 15% of what they were at the peak, even though we're having this surge in case count with the Delta variant. But you have a lot of us that have natural immunity that are driving these better results. Thank goodness.
Absolutely. Paul, thank you. And anytime you want to come back on to talk about how employers can reduce their insurance costs, we'd sure like to give you an audience.
All right. Let's put it together. I'd love to do it.
Thank you for being with us. Folks, you're listening.